Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Next time that kid's bawling and squalling, look in the mouth for 20 billion bacteria whose sole purpose is to get you more familiar with your dentist. Yeah, it's called survival of the stickiest. And these bacteria, Strep mutans is a bad one, will take the food that you're giving the kid and turn it into acid and plaque, and then later cavities and possibly gum problems. Yep, you want to look in that kid's mouth, and if you ever see any little white spots on the teeth or you see the gum issues, you want to see the dentist right away. Two kinds of gum issues: gingivitis, that's where the gums are red and swollen and maybe bleeding. That can be taken care of if you see your dentist, but it can go into a more serious one, periodontitis, and that's where the gums pull away from the teeth, and then you have damage not only to the teeth but also to the bone. And teenagers are at a risk for that for various reasons. But there's an interesting article out of International Dental Journal telling of another cause for this, and it has to do with secondary smoke that early kids are around. Young kids are around people who smoke are more likely to have caries. So that's something you can think about. But also we want you to think about how to daily take care of this. You give them a swig of water after they eat or drink anything, brush their teeth, and see the dentist. And another thing you can do is change the carbs you give them. Cool your carbs. Did you know that certain types of carbohydrates, the starches, that's potatoes, pasta, rice, if you give them hot to the child, they are more likely to cause cavities. So your pastas, cool them down, then you can heat them again. And that sounds weird, but it seems to work, not only for bacteria, but also for the stomach. So cool your carbs, then bacteria won't binge. Give a swig and a hug so decay won't set in.